Hello beautiful people of YouTube, and welcome to this video where we're gonna discuss month 10 after my labrum repair hip impingement surgery. It's been a very interesting month. There have been a lot of things going on, a lot of changes, a lot of uncertainty. So let's start from the beginning. This month, I'm back to twice a week of physical therapy, which honestly was a little bit of a shock for me because I was down to once a week in physical therapy, and now I'm back to twice a week. And even though I was telling you all that I am not ready to leave physical therapy, and now more than ever, the reality of going back to physical therapy twice a week was a little bit hard on me. But I appreciate it, and I am super grateful that I can do it. So we're just doing it. However, during this month, I got sick, so I had to skip almost 2 weeks of physical therapy. So I kind of only had probably 2.5 weeks of physical therapy to report back. But it has been very, very good for me because during this time, we've been doing something called dry needling. Dry needling is a little bit like acupuncture. It comes from a doctor that wanted to inject something once upon a time, and he forgot to actually inject the liquid, and he only injected the needle, and that benefited the muscle somehow, and they started doing this technique. Basically, the idea is to help muscles that are contracted to, extend when you pinch a needle on it. So the idea is that the needle goes into the muscle, and then the muscle pops and it relaxes it. And sometimes they add some electricity to it, so you would feel a little bit of kind of like your muscle is beating. And the other times they kind of poke you with the needle, and that is super, super painful. But all of this is so helpful because you can feel the relief an hour later. It's really, really interesting. And we've been doing that a lot with my left hip to help it with the irritation that the tendon is having. The right hip, the surgical hip, has also been needled a couple of times because of it getting also irritated. We haven't really been paying a lot of attention to the right surgical hip because the left hip has been the biggest concern lately, the one that's causing the most pain. So at the beginning, when I got sick, I think I had a cold, and I was feeling a little bit better, but I didn't want to go because I didn't want to spread the virus. My PT told me to do my table exercises and work a little bit on balance, and that triggered a lot of irritation in the left hip, the non-surgical hip. I remember it being super painful, and what he thinks happened is that when I was doing balance, which was basically a single leg squats, it's like bringing the leg down like a clock, he was thinking that probably when I was doing that, my form was not correct and my knee was pulling in, which would have pulled the tendon in, also caused a little bit of impingement in the labrum, and that basically irritated the hip. So all of this to say that if you're working on balance or in single leg exercises or even like in normal squats, make sure that your knees are in the right position. It's super, super important to remember that. Another amazing thing that happened this month is that my PT said that he didn't want me jumping for the sake of jumping, but if I wanted to try something on the ice, I was welcome to do it. I'm back in physical therapy. This is the first time that I'm back since the MRI, and I don't know how to feel about it. It's very confusing. I feel like I am living in a constant state of confusion, embracing uncertainty. After I started taking the Celebrex, the frequency of the pain has decreased, but the intensity of the pain hasn't. So I guess there is something to it. There is a win in the fact that it's not painful every single second of my life. Today I'm back, and we were talking with my physical therapist, and I asked him the same question that I've asked my surgeon and their team, which is what the heck happened, what caused this. And he said that basically I kind of have the perfect formula for irritation in the hip given my anatomy and what we know already of my cartilage, that it's torn. So he said, it's whatever you did just exacerbated it. It kind of just needed a tiny little push to start hurting, and it did. So we have 3 more weeks until we have to make a decision on whether I want to go back in for the cortisone shot. He says that he doesn't think I'm gonna be 100% better in 3 weeks, but he
hopes that if things start getting better, maybe we can push back the cortisone shot, or probably not needed. He did a couple of tests, same tests that the surgeon did, to see what the labrum is feeling like, and he actually didn't feel anything weird. Like, I don't feel much pain, which is really annoying, because this morning when I was doing my windshield wipers, I did feel a lot of pain in the labrum. So it is just very confusing. It feels like he also has the hope that it's not gonna be the labrum, the one that's gonna have to be fixed. Right now I am gonna stop jumping again, because I've been jumping for the couple, I guess, 2 weeks since I was allowed to go back to my activities. He said that I shouldn't jump for the sake of jumping, and that we're gonna stop all plyometric exercises. However, he gave me the green light to go back to jumping on the which is insane. That's like the culmination of everything that's so important to me, because when I started jumping, as you know, I was super excited. When I went back on the ice, I was double excited. But I was telling my friend, when I go back jumping on the ice, that will be it. Like, that's what I'm looking forward to. And I got the green light, which is really funny because there is so much uncertainty, and I have this pain in the left hip. But I land on the right hip, so I guess it's okay to try jumping. I'm super excited about that part. I did go skating yesterday, and it feels a little bit weird because I feel like I have lost the confidence or the trust on the left hip, which is a non-surgical one, the one that's hurting. My PT was saying that yes, it has to do with the psychological aspect of it, but he also thinks that, you know, the body just shuts down when it's in pain, so he thinks that there is something there as well that makes me feel like I am not as stable on that hip as the other one, which is ironic because the other one is a surgical hip. But anyways, that's how things are looking like right now. So we did some dry needling today in that spot of the hip that's really painful. We did some basic table exercises and just a couple of squats, and something that I want to share with you that I'm super proud of was that he was looking at my squats, and if you remember from the previous videos, I have this issue with the squats in which I don't go down like this. Like, imagine that this is my hip. I go down more of like weight on the right leg and a little bit of like a I don't know, rotated situation, and I go down like that. And he said that if we compare today versus 1 year ago, it's day and night, which is so fulfilling because I've been working on this so hard, and it's really nice to feel this amazingness and to hear this feedback. And he also said that even if we compare it with 3 months ago, like, there is a big difference. So I'm super happy to see that there is progress. I feel like in these moments of darkness and uncertainty, you do need that good feedback to keep you going. So I am appreciative of that. And yes, I'm back to physical therapy twice a week. So be careful what you wish, because you might just get it. I'm just chilling. I'm hoping for the best.
So of course I went to the ice rink and tried it. And the craziest thing is that I was able to jump no problem. And I think it's also because I land on the right leg, which was the surgical leg, and now that leg is basically the one that's holding the fort. So I guess landing on that leg is not as concerning as me landing on both legs, which would irritate the tendon of the left legs. I guess it's okay to try to jump on the ice. So I went there and I started with the very basics, a little bit concerned, not knowing what was gonna happen. Then I bumped it up to the basic jump called the bunny hop. And once I was able to do that, I figured that I should stop because I thought that I needed adult supervision to keep jumping, because you never know what can happen. But I really wanted to try the first kind of like basic jump, and I did it, and I landed it, and it was amazing. So after that, I decided to go skating outdoors. I don't think it was the best decision because outdoor ice can be a little bit bumpy and not super great qualities. So if you want to jump for the first time, I don't think I would recommend outdoor rinks, but I did it anyways. So I'm gonna upload a video of the full experience of outdoor skating, but just to give you a little bit of a taste of what that was, I landed every single jump that I tried. I tried all the jumps that I have learned so far, and even the one that I learned 3 weeks before the surgery, I landed. And that made me so happy because once again, muscle memory is real. It did work and my hip was doing okay. I think I had a little bit of pain probably in the knee, but other than that, I was doing great, which I am very, very grateful for. I want to talk to you about a realization that I had a couple of days ago. That moment where the light bulb goes boom. And this happened when I was talking to a Mexican friend. And we were talking about, this philosophy that I think is very popular in Mexico. Please, Mexican friends, correct me if I'm wrong in the comments or confirm if that's correct. But basically of something being written in your cards or in your destiny or in your life, and that it will happen no matter what. Like, I know that there is this saying basically that talks about when it's your time, even if you hide, when it's not your time, even if you put yourself in that situation, like nothing is gonna happen to you. So we were talking about these things. He was telling me, yes, like if you're gonna get the flu, you're gonna get the flu, like no matter what. Of course, not talking about living on the edge and, tempting the death or whatever. And when we were talking about all of this, I was telling him, yeah, like I think it's really important to let go and just trust that whatever happens is written in your cards. And at that point, I was like, you know what? I'm gonna be okay. I don't know how, or I don't know when, but I'm gonna be okay. And I think that idea comes also from the fact that I have first-hand evidence that my hip is doing well, that I got the surgery and now I'm stronger, my hip is doing good, I see so many changes. So with the other hip, if it comes to the worst case scenario, which would be the surgery, I know it's gonna go well. And maybe I don't have to get surgery and that's gonna mean that I'm gonna be okay. So I think this is what faith is, just have that trust that things are gonna go in a certain way and just let go of the process, like whatever happens, however we're gonna get there. I don't know when I'm gonna get there, but I know that I'm gonna be okay. Which is insane. And again, I just want to highlight the fact that I am super fortunate and grateful to have this first-hand evidence to see that my medical team is amazing, that if we get to go through the surgical route, things are gonna be okay. I think that is super, super fortunate. But we'll see. I'm just gonna let go and hope for the best, and I know that I'm gonna be okay. I finished my anti-inflammatory pill yesterday, so it's been kind of like 26 hours after I took it for the last time, and I feel okay. I actually don't think I have been in pain today, which is kind of crazy because I have been in pain every single day for different amounts of time and at different times of the day. But today I think I'm feeling better actually. So as I was saying, the anti-inflammatory pill did help. It, I guess, reduced the frequency of the pain, the intensity just a little bit, but today apparently I'm doing better. So we'll see what happens. Finishing these pills means that we're getting close to deciding whether I want to go back in for the cortisone shot or not. So, with all of that, we were hoping that the strengthening, the rest that I had, and all those things would help to calm the left hip down. But it unfortunately didn't calm me down to the point that we felt comfortable not pursuing the cortisone shot. So we went for it.